Hello, my name is Dr. Simon Rang. I'm one of the anaesthetic consultants at East Kent Hospitals. I'd like to spend a few minutes discussing the various anaesthetic options that you have available for you for your hip or your knee replacement, and go into some more details about how we can help you manage your pain after surgery. When you come into hospital on the day of your operation, you'll see the anaesthetist before you go to the operating theatre. You'll have a chance to talk about any previous anaesthetics and operations that you've had, and we'll talk to you about your medical conditions if you have any, and then discuss some of the anaesthetic techniques that may be available for you individually and help you plan your pain relief after surgery. A good anaesthetic and decent pain relief after surgery is important because this will then enable you to recover quickly, get out of bed and walk around very quickly after your operation, and help to reduce the risk of complications after surgery. There are several different types of anaesthetic that are suitable for a hip or a knee replacement. Most patients have a spinal anaesthetic, mainly because it provides very good pain relief afterwards, and you recover quickly from your operation, enabling you to get out of bed quickly and start your rehabilitation early after surgery. Contrary to popular belief, there's no need to remain fully awake during surgery if you have a spinal anaesthetic. You can have sedation or even a light general anaesthetic in addition to the spinal to make you unaware of the operation while it's happening. Some patients can't have or don't want to have a spinal anaesthetic, and in those we use a general anaesthetic alone. There is a requirement in these cases to give you some additional strong painkillers to help you through the first few hours after the operation, and these painkillers can have some side effects, but we do our best to minimise those side effects, and it's nothing to worry about if you can't or don't want to have a spinal anaesthetic. In this slide, there are some more details about a spinal anaesthetic in this short video.
A spinal anaesthetic, or spinal, is an extremely safe alternative to a general anaesthetic. During a spinal, local anaesthetic is injected in a precise way into the lower part of your back, which numbs your legs and lower half of your body. Spinal anaesthetics do not put you to sleep. Spinals are suitable for almost any operation performed below the waistline and give you excellent pain relief immediately afterwards. Spinals also avoid many of the side effects associated with general anaesthetic. Spinal anaesthetics are given by anaesthetists who are highly skilled doctors, specially trained to look after you before, during, and after your operation. Examples of operations where spinal anaesthetics are commonly used include those on the leg bones or joints, or where a general anaesthetic may not be advisable, for example because of your general health. Before your operation, the anaesthetist will visit you on the ward and ask you some questions. These are about your general health and fitness, whether you have had any previous anaesthetics, and about any allergies you might have. It is at this time that the anaesthetist will discuss the options for your anaesthetic and the reasons why you might benefit from having a spinal anaesthetic. If you agree to having a spinal, you and your anaesthetist can decide together whether you remain fully awake during the operation or would prefer to be lightly sedated so that you are not fully aware.
Most people worry about pain relief after their operation, and although we can't promise you that we can remove that pain altogether, our aim is to keep you as comfortable as we possibly can using a variety of different techniques. We like to have a standard way of communicating your level of pain, and we use a 4-point scale which you can see on this slide. It ranges from 0, where you have no pain, all the way up to 3, where you have continuous pain both at rest and on movement. We have a variety of medications that are useful for pain relief after surgery, and the nurses and the physiotherapists can help you with the positioning of your hip or your knee, and ice packs to help you with pain. Psychological distractions are very useful, so it's important to bring in reading books, laptops and tablets, and there's Wi-Fi available on the ward. Most importantly, you need a positive attitude towards your pain relief, and to remember that pain after surgery is short-lived and will rapidly get better, even over the first few days after surgery. We organise the medications available for your pain relief after surgery into the analgesia ladder. We like to give everyone simple painkillers such as paracetamol and ibuprofen, if you can take it, regularly for a few days after surgery. If you need additional painkillers, especially when you're walking around, then we can give you some weak opioids such as codeine or some stronger opioid painkillers such as morphine. And it's important to ask the nursing staff if you're in pain, because they can advise you which of those additional painkillers to take and when. Particularly the stronger painkillers have side effects, and those are things like nausea and vomiting. Some people get itching from opioid painkillers. They can cause drowsiness, give you a headache, and particularly if you take them for a long time, they can cause constipation. It is also very important to inform the nursing staff if you have any of these symptoms, because they are often easily treatable with additional medication to help reduce the severity of them. And finally, with a lot of hard work from you and from the whole team looking after you, we can have you up, walking and back to normal as quickly as possible after your operation.